Hello and welcome to week 4. This week we are focusing on emotional intelligence and holism or holistic care. And so you had a few articles to read that covered this topic. I'm going to start talking with emotional intelligence and then we'll move into holistic care. So, probably most important to understand about emotional intelligence is that it is an essential skill for a healthcare provider, but it's also one of the most important protective factors in helping address the nursing or healthcare burnout and just the high stress environment of healthcare. So the one of the research articles you read focuses on how emotional intelligence and resilience are two critical protective factors that help the healthcare profession deal with the levels of stress, clinical demands, and it specifically was looking at COVID-19, but I think it can be applied to healthcare in general because of the high stress and high burnout potential in that field. And so, what is emotional intelligence and how do we develop it? So, emotional intelligence in the article is defined as the ability to perceive, control, and assess one's own emotions. But oftentimes, we're also talking about being able to then perceive other people's emotions as well. So, the first step is being able to identify our own emotions and then be able to regulate those, and then also be able to identify the emotions of someone else and then be able to adjust to that to provide care. So, for example, for as a healthcare provider, maybe you came into a shift and the shift before you was short staffed, and so they didn't get everything done that they needed to get done, so you're already starting the shift having to do additional work that you're not supposed to, and then you also find out that somebody called in, and so you're also going to be short staffed, so you have extra work from the previous shift, you're down a person, and so you might somebody who's emotionally intelligent might recognize, okay, I'm frustrated with the situation. I'm a little anxious about how this is going to go. And so I need to, be able to regulate that so it doesn't impact my patient care. So maybe it's, whatever strategy you have. Maybe it's taking a few deep breaths. Maybe it's venting with a friend. Maybe it's calling them or somebody on the shift, just kind of talking through that this is going to be challenging, just to kind of get it out there so then you can move on. Maybe it's a quick meditation. Maybe it's some other strategy. Maybe it's talking to the charge nurse or whoever's in charge of the floor to see if you might be able to get extra help or, redistribute tasks. Whatever you think is going to help you, deal with these emotions so that it doesn't negatively impact your patients. That's what an emotionally intelligent nurse does, or emotionally intelligent healthcare provider. In addition, you an emotionally intelligent healthcare provider could walk into a patient's room and they notice that the patient is like very fidgety, very anxious, looking around, um, maybe asking lots of questions, maybe fidgety, might be like pressing that call light over and over and over again with, a lot of concerns. You might pick up on these nonverbals and their verbals that this person is anxious, they're worried, they're concerned, they don't feel like they have all the information, they're confused, they have unanswered questions. So as the emotionally intelligent healthcare provider, you say, okay, what can I do to help with this patient's emotional state? Maybe it's sitting down for a few extra minutes and finding out what all their questions are. Maybe it's calling the doctor back in to have another conversation. Um, Maybe it's just sitting and holding their hand and saying, I know this is really hard right now, because maybe there's nothing you can do. But those are the things that we want our emotionally intelligent healthcare providers to do, able to identify and regulate our own emotions and then recognize the emotions of our patient and then provide, we'll get to that, holistic care to appropriately take care of that patient. So, for the four competencies for emotional intelligence include self awareness, self management, social awareness, and relationship management. And we kind of covered most of those things already. Um, And the research was pretty clear on this that those that had higher resilience and higher emotional intelligence did better handling stress. The other concept that you're working on this week is holistic care. And so the um, a lot of times it's considered like the heart of nursing or the heart of healthcare or the as opposed to the science, right? The heart or art of nursing or healthcare. And um, it's sometimes misunderstood or seen as kind of a not as important as the tech technology and the treatment and the healthcare delivery, but holistic care is essential. The research bears this out. It shows that uh, when patients receive holistic care, their outcomes are better. And so, what we mean by holistic care is a comprehensive caring model that addresses the patient's biological, social, psychological, and spiritual needs. So, if we're not doing all of those things, then it can mean that the patient is not getting all of the care that they need. And we can't separate. Oftentimes, we're like, oh, well, we're just going to treat the patient. We don't have to worry about their social or psychosocial or emotional needs. And what we have learned is that is not the case, right? Our mental health, our emotional state, our spiritual needs impact our physical health. And so if we're not addressing the other needs that a patient has, we're not able to give them the highest quality of care. And so the research showed that holistic care improves the outcomes for both the patient, in, which they specifically found that there was a faster recovery and lower depression, but it also improved the outcomes for the nurse or healthcare provider, such as increased job satisfaction and personal development. So, holistic care is just fundamental to what we do here at Nebraska Methodist College and in healthcare in general. So there are some barriers. Some of the barriers include that there is just this biomedical focus that it really focuses narrowly on the physical. I think that is changing, but you may still find some healthcare providers who they're just that's all they're focused on, and that can be a barrier to the holistic care. um, there's also misconceptions that focusing on people's social, psychological, spiritual needs are unscientific or not part of the medical model. Um, and then lastly, there can be some systemic issues, which include not enough time, right? So, in order to appropriately address all a patient's needs, it takes more time, sometimes more resources. And so that can also be a barrier. Here were in the article, there were some strategies for helping students, nursing students in particular in this study, to increase their emotional intelligence and their holistic care. One was developing a practice of mindfulness and self care, which we again talked about in Core 101. So, a regular practice of something, whatever works for you, that could be meditation, it could be deep breathing, it could be exercise, it could be journaling, it could be music, whatever helps you kind of recenter and find that balance and that mindfulness. um, can also be environmental modifications. So, getting out into the sunlight, getting out in nature, going for walks, that can boost morale. Maybe it's just changing the environment in which you're studying or working. That can be very helpful. Peer support was another thing that helped to develop emotional intelligence and holistic care. Um, and then another thing was just um, providing opportunities for students to have challenges and build that grit and resilience to get through those. And I think we have a program here that provides those types of rigorous challenges that help then get you prepared for working in healthcare where there's going to be those challenge or even more difficult challenges perhaps. So um The takeaway here I really want you to focus on is emotional intelligence is essential. It is not optional or an add-on. We need our healthcare providers to have emotional intelligence, and that's being able to recognize and um, regulate your own emotions, as well as recognizing your patient and coworkers and other people that you're working with, recognize their emotions and adapt to their needs. And then that holistic care improves health outcomes. And we can provide holistic care by making sure that we're addressing not only the physical, but the social, mental, psychological, spiritual needs. And as we move into when we talk about social determinants of health, we'll also be talking about how do we address some of the concerns that patients have outside of the hospital setting, things like access to housing, access to insurance, access to healthy foods. Um, that also comes into play in terms of holistic care. But making sure that we recognize that they're all connected, that we can't separate one's physical health from one's mental health, and that we need to be um, providing care that addresses all of the needs of a patient. So I hope that was helpful, and I look forward to seeing you this week.